What is a normal heart rate for a school-age child, 6 to 12 years of age, in beats per minute, BPM? A. 100 to 140 BPM. B. 50 to 70 BPM. C. 70 to 120 BPM. D. 120 to 160 BPM. The answer is C. 70 to 120 BPM. Normal heart rate for a child aged 6 to 12 is 70 to 120 BPM. This is moderately higher than normal heart rate for an adult, which is 60 to 100 BPM. What is the correct way to determine proper blood pressure cuff size? A. The inflatable bladder should cover approximately 50% of the circumference of the forearm while its width should cover approximately 20%. B. The inflatable bladder should cover approximately 80% of the circumference of the forearm while its width should cover approximately 40%. C. The inflatable bladder should cover approximately 40% of the circumference of the forearm while its width should cover approximately 80%. D. The vinyl covering should be able to wrap at least twice around the forearm. The answer is B. The inflatable bladder should cover approximately 80% of the circumference of the forearm while its width should cover approximately 40%. Proper cuff size is very important for accurate blood pressure assessment. The correct way to determine proper blood pressure cuff size is to wrap the cuff around the arm, then note the area covered by the inflatable bladder. The inflatable bladder should cover approximately 80% of the circumference of the forearm while its width should cover approximately 40%. A stethoscope has two components to the chest piece. These are called the dash and the dash. A. Cone. Diaphragm. B. Bell. Diaphragm. C. Bell. Disc. D. Cone. Disc. The answer is B. Bell. Diaphragm. The chest piece of the stethoscope is made up of two components designed for auscultation, the bell and the diaphragm. The bell is dome-shaped and used for auscultation of low-pitched sounds, while the diaphragm is used to auscultate high-pitched sounds. A nurse takes a patient's blood pressure and records it at 146/92 mm of mercury. This is the patient's first visit to the clinic and they have no past medical records available. Would this patient be diagnosed with hypertension? A. Yes, this is stage I hypertension. B. No, there is not enough information. C. Yes, this is malignant hypertension. D. No, this is within the normal range. The answer is B. No, there is not enough information. A patient with a one-time high blood pressure reading cannot be diagnosed as hypertensive. A diagnosis of hypertension requires at least 3 measurements of blood pressure over 140/90 mm of mercury on at least 2 separate visits to healthcare provider. A patient with a blood pressure reading of 168/102 mm of mercury on 3 or more occasions would be diagnosed with what stage of hypertension? A. Stage 3 hypertension. B. Stage I hypertension. C. Stage 2 hypertension. D. Pre-hypertension. The answer is C. Stage 2 hypertension. Stage 2 hypertension is defined as a blood pressure equal to or greater than 160 mm of mercury systolic over 100 mm of mercury diastolic, taken at 3 different times on at least 2 separate occasions. Stage I hypertension is systolic blood pressure of 140 to 160 mm of mercury or diastolic blood pressure of 90 to 100 mm of mercury, while prehypertension is defined as a systolic blood pressure of 120 to 140 mm of mercury or diastolic blood pressure of 80 to 90 mm of mercury. Which of the following is not a normal part of taking a patient's vitals? A. Overall visual appearance. B. Pulse. C. Temperature. D. All of these are part of taking a patient's vitals. The answer is D. All of these are part of taking a patient's vitals. While most examiners remember to take the pulse, temperature, and blood pressure while assessing their patient's vitals, overall visual appearance is also an important part of an individual's vitals. Does the patient appear ill? Anxious? Are there any noticeable issues with hygiene or bizarre dress or movements? Are there any signs of pallor, jaundice, or cyanosis? All of these observations can be quickly noted in a patient's chart when taking vitals. The pulse of your patient is 120 beats per minute. What is the appropriate term for this finding? A. Normal heart rate. B. Tachycardia. C. Bradycardia. D. Aortic stenosis. E. Asystole. The answer is B. Tachycardia. Tachycardia is the term used to describe a faster than normal heart rate. A heart rate of more than 100 beats per minute is considered tachycardic. Bradycardia is used to describe a slower than normal heart rate. Less than 60 beats per minute is considered bradycardia. The physician on call pages you to ask if the patient you are taking care of is febrile. Which of the following vital signs would you find in an febrile patient? A. Blood pressure of 105 over 89 mm of mercury. B. Temperature of 97.9 degrees Fahrenheit. C. Respiratory rate greater than 25 breaths per minute. D. Heart rate of 105 beats per minute. E. Temperature of 103.2 degrees Fahrenheit. The answer is B. Temperature of 97.9 degree Fahrenheit. Febrile is a term used to describe a patient who does not have a fever. Clinically, a fever is defined as a temperature greater than 100.4 degree Fahrenheit. Blood pressure, heart rate, and respiratory rate do not tell you if the patient has a fever. A 39-year-old man presents to the ER with weakness, confusion, and vertigo. His heart rate is 91 and bounding, blood pressure is 132 over 85 mm of mercury, temperature is 99.0 F, and blood glucose is 49 mg per deciliter. He is non-diabetic, he is not on any medication, and he denies recreational drug use. Which of the following is the most likely cause of his symptoms? A. Hypertension. B. Hypoglycemia. C. Panic attack. D. Infection. The answer is B. Hypoglycemia. The most likely cause of his symptoms is hypoglycemia, which is defined as a blood glucose below 50 mg per deciliter in a non-diabetic patient. The symptoms of hypoglycemia include altered consciousness, tremors, weakness, vertigo, headaches, heart palpitations, and a bounding pulse. A temperature of 99.0 degree Fahrenheit is not considered abnormal as it may reflect a normal variation in body temperature. His blood pressure is slightly elevated, but it is unclear whether this is typical for him or whether this represents a significant change from his normal blood pressure. Regardless, it would not likely be sufficiently elevated to cause his symptoms. It is also possible he may be experiencing a panic attack, but in the presence of his depressed blood sugar, and absence of signs of anxiety, hypoglycemia is the most likely cause of his symptoms. Abdominal rigidity and decreased bowel sounds would raise your suspicions of what condition? A. Cystitis. B. Cholecystitis. C. Peritonitis. D. Ulcerative colitis. The answer is C. Peritonitis. Abdominal rigidity and decreased bowel sounds are classic signs of peritonitis. In addition, the patient will often want to lie very still, as any motion often increases pain. Cystitis, ulcerative colitis, and cholecystitis all may cause significant abdominal tenderness but would not generally result in rigidity or decreased bowel sounds.